little bit about how to adjust a pregnant person. One of the things you want to make sure of is that you have a table that's set just for that, and a pregnant person kind of helps. So we're going to bring the table up. Come on over. The pregnancy table is a critical piece of adjusting equipment to have. It has a hole cut out of the middle. In the beginning part of the pregnancy, you put it up at the top there to allow be a little bit more comfortable for the tenderness up top. And then of course, as the pregnancy goes on, we can put it down around the belly to support. These Zenith tables have a piece that adapts this way, so pregnant ladies love the fact that they get to, this is the only place they get to lie face down. Okay, I'm gonna get you to step up there, yeah. There. You wanna help? Okay. You can press the button. There you go, yeah. Perfect. Awesome, thank you. So whenever you're assessing, especially in a late stage pregnancy, it's always really important to check for in utero constraint first. Because if you're ever going to make that adjustment, it's actually the only adjustment that you'll do on that visit, because it involves, I've heard a number of different explanations why, but the biggest thing is it involves mostly a parasympathetic response. And so if that's the area you're adjusting, it's the only adjustment you're doing. So I'll check it first. So if you want to come over here, see if you can see this. So come right over here, have a look down at her feet, right from above here, right up above. So can you see how that left leg is shorter than the right through there? Can you see it?
Yes.
Okay. So turn your head to the left side. Turn your head to the other way. And back to the middle. So neither of those cleared that. So now I'm going to check for in utero constraint. So you bring these up. And feel for the resistance bilaterally. And she's clear of that today, so we don't have to do that adjustment. That utero constraint adjustment, formerly known as like a breech technique, the Webster in utero technique. It's known by a lot of names. A lot of people know it as the technique that you use to turn breech babies. Really all it does is frees up all the stress on the uterus to allow the most space for the baby to have the room that they need. So the technique we use here is called Thompson technique. This is called the Thompson table. So you're going to hear a noise in just a second. That noise is air going into the pieces of the table, having them pop up. So if I press a button here, they come up, and when I adjust, they'll drop down. So if you want to come look at this, you can see that those are even now. So that's brought the balance back into the pelvis. And we're going to check the upper part here. So turn your head to the right side. Straight down. That's been pretty sore, you said? Yeah. You want to help press the button? Ready? You already know that one right there. All right. Good job. Okay. You put your hands right there. Okay, smile. It's important. Positive energy.
Especially when everything's been tender.
Sore but balanced. sinuses cleared.
Yeah.
That's better. Perfect. That's a happy, healthy mom.
Perfect.
Awesome.
Thank you.
Thank you. Thanks, girls, for help.
Say thank you.
You're welcome. Okay. Now we're going to do a kids adjustment. Who wants to do a kids adjustment? Are you?